situation where you don't have anything, our hospitals are not equipped to absorb anything beyond just the immediate life-saving action, which means if you come in with a heart attack when you're, let's say, 45, we'll take you in and get that blood vessel open and get your heart going again. But what happens when you've got to follow up for those medications? What happens to prevent the heart attack again? What happens to prevent that stent we put in your heart from shutting down? You'll have none of that care, which means that in the next decade, you'll just have another massive heart attack, and this time might not be so lucky. And these are not scary stories I'm telling because it's Halloween. This is just a fact of what is happening in the United States.
No, for sure. I think everybody needs to know this. I know you mentioned that young people do need that insurance and they want to cut back. When you mentioned the car accidents, those are issues that a lot of young people have. They get into an accident, they need to go to the doctor. For example, if somebody goes to the doctor and they get into an accident and the scans tell them that they don't have injuries, they'll try to cut back on costs by not going to physical therapy, even if they feel sensations or tingles in their body. Should they still consider the physical therapy even after not having injuries from an accident? Or do you think it's better to cut those costs and maybe not go for physical therapy?
Oh gosh, no. Never cut those costs because the thing is, when you come to the hospital after you've had an accident, I as the doctor have one agenda, and that is I don't want you to die. So everything that I do is focused on that specific thing. So if you had a little, twist of the knee, but it's not going to kill you, but you've got something else going on that is, and I focus and I fix that, what ends up happening is the management of that twisting of your knee will be done as an outpatient. So once I discharge you from the hospital, you'll need that physical therapy to get back to mobilizing properly again, which is walking, ensuring that you don't get those blood clots that can happen, if you don't walk around enough. And most importantly, let's say you have this car accident at 30, at 60, you're going to have severe arthritis of that knee if it's not been appropriately managed and you've not been able to start to walk normally again. So if you don't go to that outpatient-based care, you're going to have a serious issue. And that's a big change in the United States over the last few years, is that we have been moving a lot of care to the outpatient setting. So things that patients would come into the hospital, and your grandparents can probably tell you, coming into the hospital, we would keep somebody in hospital like a week, 2 weeks, 3 weeks for a hernia repair. Those days are long gone. Now people come in, they get the hernia repair, they even leave the same day potentially. But that doesn't mean that they're better. It just means that the acute hospital care no longer needs to happen. And the reason we've been doing this, by the way, is because patients have increased so much in volume and we simply don't have enough beds, as anybody who's been to a hospital knows. So just because you're not in the hospital does not mean that that's not a continued progression of your care and something that you shouldn't engage in. You very much should, because otherwise it's going to come and bite you later on.
So you're saying if you get in an accident and the x-rays come back and the MRIs come back and they show that you don't have any injuries, you should still consider physical therapy?
If that's something your doctor prescribes, certainly. We will only prescribe it if we think that you need it. And, for example, you mentioned x-rays or imaging and whatnot. Let's say that you had a dislocation of a joint, right? But then the joint popped back into place. You may have a little bit of inflammation on MRI potentially, but other than that, you won't really have anything major that is anatomically disruptive. So it's going to look fine, but you may be in severe pain. So if you try to move your arm up, you have a lot of pain. So what do? You go home and do? You keep your shoulder frozen and you say, I'm not going to move it. I'm just going to pop some ibuprofen. I'm not going to do anything. And then guess what? A month later, when the pain is subsided and you try to move your arm, it's now frozen in that location, which is why the physical therapy is so important. So it's really all about what your doctor tells you to do at that time to ensure that you have the best overall outcome to getting back to the life that you had prior to the accident.
Yeah, and are all doctors required to accept ACA insurance?
I'm not sure if all doctors are required to. I think it does depend on where you actually work. I'm not 100% sure on that answer, but I don't believe so. I think it's all about whether or not that particular place is associated with this type of insurance. Not all doctors are even required to do Medicare and Medicaid. It just depends because, again, as I mentioned, a lot of places have gone to the outpatient setting now. And so if it's an outpatient-based area that's owned and it's privately run by a group of physicians or private equity or something like that, they may not be required to take certain types of insurances. And that's the reason why when you get your ACA plan, you really have to check to see whether or not what you need and what your doctor, what network they're a part of, is covered by the plan that you're picking up.
And I believe in your recent video, you mentioned that people are scared about those higher premiums, what that means for access to care. So what are you hearing most from patients right now that you're interacting with on a daily basis? How are they feeling and what are they saying to you?
Oh, they're terrified. They're terrified. We're terrified. The hospital is terrified. Nobody knows what's going to happen, and that uncertainty is very unsettling. You know, even if nothing were to happen, which we already know for sure that the premiums are going to go up, but let's pretend that they even didn't. This is a very traumatic time for a lot of people. And right now, you know, people may not even be going on the website because just hearing about this on the news is enough of a deterrent for them to say, oh, I know my premiums are going to go up. I'm not going to re-enroll. Forget about it. And not even going and trying. And so what we're seeing at this point is people really getting concerned that they're not going to be able to have the coverage that they need. And this is not a new concern. You know, unfortunately, as long as I've been a doctor, I've heard people say that they're worried about getting coverage. We actually hear it the most around this time of the year because people are, you know, getting everything covered at this point because they've met their deductible. But then when everything kicks off again next year, they want all their surgeries and whatnot done now before they have to pay again next year. And so we hear a lot about this currently from patients who are worried that they're not going to be able to get the care that they need if we go past December 31st.
Absolutely. Again, we want to remind folks at home today is open enrollment. We have Dr. Dua who is joining us today, who is encouraging everybody to sign up. And then, Dr. Dua, if you could say just one thing to people at home watching you right now here in the DMV area, what would you like them to take from this conversation?
Well, I want to tell them that I'm so sorry that this is the situation that we are all in currently, and that I know it's incredibly stressful and anxiety-provoking, but always know that your doctors are here for you. Whatever you need, we are here to help you. And so if you need help with enrollment, if you need help with taking the next step, reach out to your primary care physicians, reach out to your consultants like myself, and we are happy to help you get through this. I know it's very difficult, but it's going to be okay, and we are here to take care of you.
I love that. And as a doctor, how has this impacted your daily work life when you go and meet patients? Have you seen drastic changes because of those higher premiums?
I think the biggest thing is, again, that people are worried about what we're doing for them. So, for example, if I tell a patient, look, I really think you need a CT scan, and then I think I need to get you to come back in to get this ultrasound, and then you're going to need surgery, I'm hearing for the first time people say, how much is that going to cost? Which, of course, as the doctor, as part of our unfortunate system, first of all, I have no clue because every patient is different and, you know, the hospital bills differently. And I mentioned earlier about, you know, lack of transparency in prices, which is a major problem. But what I hear in the patient's voice is, if it costs too much, I can't or I won't do it. And that's really concerning because I know that that same patient, whether they meet me electively to get the surgery that I need them to get, or I see them, unfortunately, 6 months from now in the ER when it's too late, I'm going to see them again. And the reason that they're going to be in this terrible situation 6 months down the line is because they couldn't afford a basic intervention now because their premiums were too high for them to get the coverage. And that's really sad.
That's incredibly sad. And when we talk about those higher premiums, how will they be impacting communities of color across our nation?
I think in that particular realm, you know, unfortunately, everyone is sort of in the same boat. Everybody for this thing, because, you know, healthcare impacts everybody equally. But there are some communities that definitely have more medical issues or are in a socioeconomically lower strata that unfortunately are more affected by these sorts of things, especially when you add to this the idea of going onto a website that can be really daunting. There's a lot of information to go through. You have to collect a lot of documents. And any community, whether of color or not, that has difficulty, you know, bringing together all that material is going to have difficulty enrolling and taking it to the next step. So I think, unfortunately, this particular thing is an equal opportunity messer-upper that's going to hurt everybody, regardless of what color they are.
And what's the biggest misconception you think, as a doctor, people have about open enrollment?
I think that there's a lot of political kind of information that's around it that is confusing. Nobody really understands. There's not one word, you know, open enrollment. What does that mean? Are we talking about open enrollment for the employer? Are we talking about a hospital here? Is this the Affordable Care Act? Is this Medicaid? You know, what is this? And there are a lot of misconceptions about whether or not the government is involved, like is this Obamacare or not? And I think people just don't really know what they're dealing with. And so that part of it makes it very confusing. So if they're going to sign up, what are they actually signing up for? And then once they get on the website, there's a little bit of confusion as to what they should click and who they should call to ask if they have a question. Because I'll tell you, I actually, just to prepare to talk to you today, went on the website to take a look at it. And even me, within the first 2 minutes, was stopped with, oh, I'm not sure. I don't know where I'd find that document. And I'm a surgeon in a hospital. So if I can't do it, surely it's going to be challenging for others. And that's why I mentioned earlier, there is a phone number on the website. Really call it. And if that doesn't help you, feel free to contact your local primary care doctor or your doctors, because at the end of the day, we really do want to help you. We also are overwhelmed with patients, but we are acutely aware that we all got into this profession to take care of you, and this is part of taking care of you.